horizontal. Anterior-posterior plane is new plane for you, new plane. These all three planes pass perpendicular to each other. Perpendicular on all our normal anatomical, so-called normal anatomical position. We'll describe from this position of human body. In all textbooks, normal anatomical position is this. And we will take all preparation in accordance with this vertical standing posture, with hands face forward and the foot face forward. And in this position, we can describe three planes: frontal plane, sagittal plane, and horizontal plane. Three perpendicular planes. The frontal plane passes parallel to the forehead and divides anterior-posterior. You have written this. Then sagittal plane. Sagitta in Latin, it means arouse. Arouse, how it passes in anterior-posterior direction. That is why sagittal plane goes in anterior-posterior direction and divides our body into what halves? Right and left. Dexter, sinister. They are connected with this plane, dexter and sinister. Or the plane which passes just on midline of our body, midline, it is called mediana. Median plane or mediana. Median plane. And for the bones of the trunk, for example, for the clavicle, we'll describe the medial, it means medialis, near the midline. Lateralis, far from midline. For example, clavicle, our clavicle, it has medial end near the midline and lateral end, far from midline. Medial, lateral, or right, left. This term connected with sagittal plane. But sagittal plane can be passed through each point of our body. The third plane is called horizontal, which divides our body.
How many axes you know?
In sagittal plane, what axis passes? Sagittal axis. And the horizontal plane divides our body into upper part and lower part, superior, inferior. Or synonyms: in upper part we have cranium, in lower part we have the true tail, cauda. For the Homo sapiens, cauda of animal is reduced. And we have oscopsigis.
This is low for anatomy.
But below lies our tail region, oscopsigis. Above lies cranium, head. That is why cranialis, caudalis, they are synonyms of superior, inferior. For example, when we describe the vertebral column, we say cranially, it means in superior direction, caudally, in inferior direction. Caudal, cranial. And in different parts, for example, now student of the second year study the brain, and in cranial part of the brain, anterior part, on caudal part of the brain, spinal cord. Cranial, caudal. Cranialis in Latin, caudalis. Superior, inferior. Superior, inferior. This term is connected with horizontal plane. Horizontal plane. But axis is called in horizontal and frontal plane we have transverse axis. The third axis is longitudinalis or verticalis. Axis longitudinalis or verticalis. Thus we have three planes, three axes. What planes? Frontal, sagittal, horizontal. Three perpendicular planes. Frontal, sagittal, and horizontal. These three perpendicular planes, three dimensions, in three sagittal, frontal, and horizontal. They can pass through our body: sagittal, frontal, and horizontal. Three planes and three axes: transverse or frontal. It passes in frontal or in horizontal also. We have transverse. sagittal and verticalis, axis verticalis or axis longitudinalis. Of course, we will use many other terms. The principle, we will use the parts of our body. I will introduce head, caput, head, caput, column, cervix, neck. Neck is column or cervix. Thorax, breast. Our breast by skeleton corresponds to thorax. Our trunk consists of thorax, abdomen, pelvis, parts of the trunk. Thorax, back, abdomen, venter, abdomen, thorax or breast, parts of the body. Our limbs, upper limbs, lower limbs, hand, foot, different parts of the limbs we'll study next. For anatomy is subject, the basic subject of medicine. It is ABC of medicine. It is anatomy and physiology. Structure, anatomy studies structure of organs, their development, their structure, and their function together. And anomaly, variants of development, of course, we will describe. And during this description, you will use different terms for description of the structures. You will use term this, which I have explained just above, and also you will use externus, internus, superficialis, profundus, superficial and deep, proximal, distal. Proximalis, it means closer to the body. Distalis, far from the body. Use for the limbs, you will use proximalis, distalis. For example, hand lies distally, then brachium. Brachium lies proximally, hand lies distally, foot lies distally, thigh lies proximally. Most superficially, this external surface, this internal surface. We can describe superficial muscles and deep muscles. And many other terms with each topic classes will describe these terms. Now our skeleton. Skeleton consists of is the teacher introduced with our plan of study no, shortly I will introduce that every week you will have on the first day this practical classes at first, and then after classes you will have 1 hour lecture. 1 hour lecture. During lecture we'll discuss general survey of some topic. For example, first lectures will be introduction with the subject of anatomy and the methods, anatomical or methods you will listen during lecture. And then structure of the skeleton. Now we'll start from the bony system. Our study of anatomy will start from bony system, but we can describe, we can distinguish systems and apparatus of organs. Organization of the body. You know that our tissues consist of cells. Histological cells consist of very small microscopic organelles, then cells, then from cells consist tissue, different type of tissue, epithelial, nervous, muscular, connective tissue we have in our body. From this tissue is composed organs, different organs. And organs form system of organs. What does it mean, system of organs? System, group of organs which have the same development, same structure, same function they have. They form the system of organs. For example, bony system or respiratory system or digestive system. Group of organs which have the same structure, function, development, structure and function. But several systems can combine in more big system of all or apparatus. They are called apparatus. Apparatus is bigger, higher than systems. For example, bony system, joints, muscular system. They together form local motor apparatus. All these term until second term. We'll study and finish what apparatus? Locomotor apparatus, which comprises bones, bony system, joints. They form passive part of this locomotor apparatus. Our skeleton consists of bones. These bones, they are form junction by means articulation or uninterrupted junctions or interrupted articulation through synovial joints they form. And these joints move by muscles. Active part of locomotor apparatus form muscles, muscular system. There's three systems which have different origin, different structure, but the same function, locomotion, the mobility of our body, the movements of our body. They are responsible for movements, all these three systems together perform our all movements. That is why they combined in one apparatus, or urogenital apparatus. It is not correct to say urogenital system. We have urinary system, genital system. Together form urogenital apparatus, because different structure they have, urinary genital, kidney, urinary bladder, ureter, or for example, penis, scrotum, testes, but they have the same function. With the penis passes sperma and urine together. The function is the same, combined into one apparatus. Now we study what apparatus? We study what apparatus? Locomotor apparatus. And among this apparatus, what system? We describe now bony system, and bony system forms our skeleton. Yes, bony system, bony tissue, general survey of bones, skeleton, muscles, joints, skull. You will listen during lecture. The general development, the general question of their structure, function. During practical classes, they are more important and longer, about 3.5 hours. They take. You will discuss the structure of the bones, each bone of our skeleton. There are more than 200 bones in our skeleton. And schematically, our skeleton can be represented so. Our skeleton consists of skeleton into two parts. Skeleton consists of skeleton of the trunk, skeleton divides skeleton of the trunk and skeleton of the limbs. Our skeleton divides in two areas. Skeleton of the trunk and skeleton of the upper lower limbs. What structures form the skeleton of the trunk? What bones form? Vertebral column, columna vertebralis. In Latin, at first you will say noun, columna, and then adjective. Vertebralis, columna vertebralis, no vertebral column, columna vertebralis. Vertebral column in Latin, columna vertebralis. At first columna, then vertebralis.
Consists of one etiology. So the joints with their
trunk is formed by columna vertebralis, 12 pairs of the ribs, right and left, 12 pairs. We have 12 pairs of the ribs. And in front, they form junction with sternum, the bones of the thorax. Sternum and sternum. Sternum. 12 pairs of the ribs and vertebral column. They form our skeleton of the trunk. We have also skeleton of the head. It is skull. Skull we'll study separately. After skeleton of the body and limbs, we will study skeleton of the head. Vertebral. Your home test today will be skeleton of the trunk today. Next will be skeleton of the upper and lower limbs. This skeleton in turn, upper and lower, divides into two parts. Skeleton of upper and lower limbs divides into two parts. Skeleton of the girdle, shoulder girdle, pelvic girdle. And three parts. Shoulder girdle bones, clavicle and scapula. Pelvic girdle is this bone, hip bone, os coxa. Girdle, it means bones which connect free part with the trunk. What bones connect? Clavicle and scapula. Two bones. We have a direct connection of ribs and upper part, upper limb. They connected through so-called shoulder girdle bones, clavicle and scapula. And lower limbs connected with the trunk through this bone, which is called os coxe or hip bone in English. Hip bone or os coxe. Next part of the limb is free part. Free part. Girdle part and free part. Free part of upper limb, free part of lower limb. Free part of upper limb. Next class is, don't write. Brachium consists of humerus. Antebrachium consists of radius ulna and 27 bones of Manus. And our lower limb consists of three parts. On the thigh we have os femur. On the crus we have tibia, fibula, and we have 26 bones of the foot. They form free part of upper limb, free part of the lower limb.